whatever has been prepared, we have already talked about it, but I think I'll just use the side notes that I prepared just from what we had been told, and also fill in from what maybe might have bypassed. So I think for the interest of climate change and everything to do with what you've been told, we have to know that when you talk about climate change, the precursor before it is environmental conservation, because that is where we all start from. Before we start talking about the science of climate change, we have to know how do we go through the day-to-day activities, because we know climate change is a whole long-term process. So on what we do is what will determine whether the climate will change positively or will change negatively. And it's interesting that only, I think, less than 5% of us participated in the National Tree Planting Day, which brings us to the big question, Madaktari, where are you in terms of what you're talking about? And when you talk about climate science or climate change, we have to talk about the integrity of the environment. We have to talk about the health of the environment, because when you go to the zoonotic diseases, to the diseases or the health impacts that are caused by the changing climate, they come from the degradation of the planet that we are talking about. I think Dr. Ojijo mentioned about the triple planetary crisis, that is plastic pollution, biodiversity loss, and now climate change. When you look at the entire system, they are all interlinked, and when you now talk about biodiversity loss, that is now where we start uprooting diseases by diseases, one by one. Yeah, so I think I'll just go fast. I don't think I'll use the slides, but that is the climate change effects. We've talked about the droughts, about the effects in agriculture, malnutrition, they all fall there. Next slide. Yeah, water resources, they are also affected by climate change, because we are having a strain that now leads to an exacerbation of the conflicts, limited resources in some regions, and I think all these have been mentioned, so you can move to the next one. Yes, and now this is where we now have the bigger challenges, because if we look at the whole science about climate change, there's a bit of it that we, how many of us know about permafrost? Some little bit about this thing called permafrost. It is permanently frozen ground, and the more we have things to do with climate change, because that is also part of biodiversity, the more it melts, the more it brings out greenhouse gases for the likes of methane. The more we add methane, the more it now increases the rate of climate change. That is what we call a feedback loop in terms of the climate science. So we can see the climate changing, it disrupts ecosystems. And one thing I forgot to mention, climate change is about a system. It's not one thing that is changing. We talk about carbon dioxide or carbon dioxide because it is the main cause of climate change, but you have a whole list of other greenhouse gases that are attributed to climate change. When we talk about the agricultural sector, we have methane. When we talk about the transport sector, we have aerosols. All of these now come to lead to climate change, but we focus on carbon dioxide because it is persistent in the environment or in the atmosphere. Looking at something like methane that now comes from permafrost, it is actually around 21 times worse in terms of causing climate change than carbon dioxide. But now the other bit of it is that it is short-lived in the environment, so that is why it is not considered as the main cause of climate change. So we can move to the next one. Yeah, so when we look at this slide, we are talking about the vulnerable communities. And I think currently I'm working with the National Treasury. I know you've all heard about the FLOCA program, that is the Financing Locally Led Climate Action. And whatever my colleagues have mentioned about the communities, that is what we are really trying to do. The question that was asked about adaptation and mitigation that we're going to look at Kenya right now, in terms of the policies, is focusing more on adaptation, looking at the priority of the country in the next 5 years from the National Climate Change Action Plan. The country is focusing more on adaptation. So when you look at the vulnerability of the communities, we are now having the rains in each part of the country, but we are looking at other parts of the country facing let's say more effects in terms of flooding, in terms of the runoffs, in terms of the washing away of the crops, in terms of the landslides. But you see, for example, Nairobi is a bit moderate in terms of the effects that are happening. So what measures vulnerability in terms of the effects? We now look at in terms of the exposure, which are these bits of the community? Is it in terms of gender? Is it in terms of the work that people do? So we look about the income of the people, because that is also a factor in terms of the exposure. People who earn more, which starts from the local level and also goes to the bit of the country or regional level. Right now we're talking about the developing and developed countries. The developed countries are able to cushion themselves from climate change, rather than the developing countries, the small island developing states. They still have a low rate of exposure, and they have a high rate of exposure and a low rate of how they can be able to cushion themselves. Vulnerability also comes in terms of sensitivity, of how people are sensitive to the effects of climate change. If we have changing rates in terms of the heat strokes, in terms of the heat waves, in terms of the cold waves, how are people sensitive to what is coming, what is happening? We can compare someone, the small children, to us who are now in the youth setup. We can be able to actually cushion ourselves very well, able to see that children are more sensitive when we now have the effects of climate change. So that makes them more vulnerable to effects of climate change. And now lastly, in terms of the resilience, we talk about the adaptive capacity of the communities. How well can they create resilience to what is happening? And that is where now we have the issue or the bit about the indigenous communities. We can go to the next one. The adaptation and mitigation strategies have all been mentioned. We can see some of them: improved water management, drought-resistant crops, afforestation and deforestation. And just by the way, if we have some of us, maybe those who are having initiatives back at their homes, currently, as I said, the government is working more on adaptation strategies. And as at now, the projects that are being approved in terms of the FLOCA program, they fall into the water sector, the agricultural sector, and the environment sector. So that forms the first three. So if you have a program back at home, or you know someone who's working on some of them at the world level, kindly advise them to at least structure their proposals or their activities in between the three, so that they can be able to maybe attract some funding or support from the government. And the last one on renewable energy revolution, which is actually a major topic and a discussion that is with us. Because when you talk about adaptation, when you talk about mitigation, as Kenya, as Africa, we still need to develop, right? Because we have a lot of resources. But now our growth or our development is now limited because of the impacts of climate change. Because the more we develop with the easily available resources, that is fossil fuel, it now increases the rate of climate change. So we need to actually look into the renewable energy revolution. And as per the country statistics, Kenya, I think we are leading in Africa. Right now we are at 92% clean energy, and which is set, we are an environmentalist, and as Kenyans we are targeting to get to 100% renewable energy by 2032. So I think as doctors you can also help us on the same. I think we can go to the next one. No, there is one that we actually, I think I'll just choose this one. I think on the health index, we can look at some of the statistics of how climate change is affecting people in terms of the health effects. We can also look at the economic effects of now the health-related challenges And we can see the direct health cost by climate change are estimated to cost between 2 billion and 4 billion annually. And we know that there is a direct relation on the health of the population and the output, because a healthy working nation can be able to now have more output. So when you talk about the health-related effects, we have to also consider the economic bit of it. And we can also see that the health index can also lead to other social determinants that are now undermined in terms of the livelihoods, in terms of equality, in terms of the social services and access to health care. And I think as we go to the next slide, there's a question actually we were trying to brainstorm, which I think I'll also pose to you, that is it that climate change causes the diseases, or climate change is an amplifier of the diseases that we are talking about? So I think we can be able to think about that. And one thing that you have not been able to mention, I think, for today, as per the event theme and the event organizing, we talk about SDG number 3, and that is on good health and well-being. And the goal is to ensure healthy lives and promote a well-being for all at all ages. And for that, we can see some specific targets that are there. I know there are a lot of targets under the SDG number 3, but just for the sake of what we are doing today, I try to narrow them down to goal 3.9, which talks about reducing mortality rates. Goal 3C, now the increasing health financing, because I think my former colleague talked about something to do with the Paris Agreement that was passed, and we have some specific aspects that we as developing countries need from the developed countries. That comes first in terms of the financing bit. Secondly, it comes in terms of capacity building. That it comes in terms of technology development. So looking at all these things that are here, they are also encompassed in the other strategies. And just to add, we know that Kenya is actually leading in terms of the policy interventions. And looking at the climate space, because from the presentations that you've had, we are seeing that the health impacts or the health effects that are caused by climate change, they are mostly caused by the emissions that we're having, and that is why we are talking about mitigation. The health effects that we are looking at, they are caused by the challenges that are there. That is why we are talking about enhancing our adaptive capacity and resilience. And some of the laws that we have in Kenya that are now championing for good health, we are now looking, starting from the Constitution of Kenya, where I think it's Article 42, it talks about ensuring that the citizens are having healthy livelihoods. And the government is supposed to actually eliminate any cause of health effects that comes to the citizens. So we should be able, as health practitioners, as young environmentalists, to base on some of these policies to be able to now call out the government and tell them this is what is happening, this is what the Constitution says, and this is what is supposed to be done. Looking at some bits, the National Environment Policy that now aims to ensure a quality life to the citizens. Looking at the Paris Agreement that now several articles talk about mitigation, talk about adaptation, they talk about conservation and enhancing the sinks and reservoirs. And as I finish up, I think there's one thing that from, I think this is far-fetched, but from the Ministry of Environment, they, in terms of the bottom-up agenda and the other strategies that the ministries are using, there is the whole of government approach, there is the whole of society approach, which now calls for each and every person to participate in what we are talking in terms of the resolutions or in terms of the recommendations that we're having. It is not the work of the so-called environmentalists, not the work of the people who do things to do with the environment, to be able to champion or to do the tree planting, to do the mitigation, or to come up with solutions. It is a whole of society approach. Each and every person in the different professions, I believe there is a bit that can be able, that can be done by each and every person. And as people from the science field, I think we really bank on looking for information, reading, which I know is the case also among the doctors. And we have a lot of policies, documents, strategies that the government has been able to put forward. And at the beginning of the year, I know you all know we had the Africa Climate Summit. We had a lot of documents that were launched. We have the strategies of the short-lived pollutants in the atmosphere. We can be able to look at that and see how we as health practitioners can be able to bank onto that and look at now the emissions that are coming from the health sector. We have the National Climate Change Action Plan, which is now the main document that now guides the country in terms of the strategies that are going to be set for the next 5 years. We can be able to look at that. My colleague also mentioned about the COP28. We have the nationally determined contributions, which I believe Kenya is working towards a reduction in emission of 32% of greenhouse gases by 2032. We know each country is supposed to ratify, and each country is supposed to give their output on how they've been able to now work on the emissions. So as health practitioners, it is also a good move for us to come up with the documents. I was really happy. I think it was Maureen who talked about the action, the policies, bringing the communities together, catalyzing action. And we are really trying to also push an intervention between science, which we have talked about, climate science. We are trying to link the science to the policies that are there in the government. And one thing that you need to know about, I'll narrow down to the environment policies, climate change policies. Any policy that is international, any policy that has been passed, let's say by the Paris Agreement, that Kenya is a signatory to, the policies now form part of Kenya's laws. So if you look at all the policies at the global level and you find that Kenya is a signatory to it, then you need to know they form part of Kenya's law, and that means that they need to be utilized at the local and national level. So looking at everything that you've been able to mention, then that means that we need to link the science policy aspect to the practical bits that we are trying to do. So I think one thing that we also need to remember is that in every strategy that we move, the late Professor Wangari Maathai used to have a very famous quote that you need to think globally and act locally. Climate change is not affecting the entire globe equally. It's not affecting the global north, the global south on an equal level. So we need to look at how the system has been structured. We need to look at how the regulatory frameworks have been structured, and now tailor it to what functions for Kenya, what functions for Africa, because we are all from one region. So I think with that, I don't think I have some other slides, but yes, we need to actually, we need to look at these things very carefully. And one last quote also from the late Professor Wangari Maathai. She said that you cannot conserve the environment unless you inform the people, you empower them, and you let them know that the resources are there and they need to protect them. That's it. Thank you and have a nice afternoon.